Hello, everybody. My name is Dr. Joshi, founder of Prestige 2.0, and I'm here to talk to you about why you may not be responding to your GLP-1 medications like you should. Oftentimes, we encounter patients at Prestige who have tried GLP-1 medications, whether that's semaglutide, tirzepatide, or some of the brand name variants of these two medications, and they simply do not see the results that they see among others. Oftentimes, you'll hear patients say, "Oh, well, my neighbor lost 20 pounds, or my cousin lost 40 pounds. I'm not losing any weight. What's going on?" And often, what happens for these patients is that they'll just keep increasing the dose over and over. Higher dose, higher dose. "Oh, I have nausea. I don't care. Higher dose. Oh, I don't feel so good. I don't care. Higher dose." And I'm here to tell you that adjusting the dose is only one piece of the puzzle when it comes to identifying your response rate to GLP-1 medications. So before we break that down into further detail, let's talk a little bit about what a response actually is. There's symptomatic responses and there's objective response. So the symptomatic responses would be a decrease in the cravings and a relative increase in appetite suppression, meaning you have less of a desire to eat food, and when you eat, you get full faster, hence you eat less food. Those are symptomatic characteristics of GLP-1 medications working for you. Now, the objective metric, which we can all guess, is the actual weight loss itself. For many of our patients, we tend to focus on a weight loss rate of around 3 pounds per week. That seems to be the sweet spot because 3 by 4 is 12, so you're losing around 10 to 12 pounds a month. And 3 pounds a week is a relatively sustainable rate if you incorporate diet and exercise and other behavioral modifications into your overall lifestyle. What frustrates a lot of patients is when they don't even meet that metric, when it's 1 pound a week, when it's half a pound a week, when it's "I haven't lost weight in 2 weeks and I just keep injecting myself. What's going on?" I'm here to tell you that adjusting the dose and the lifestyle modifications, as I said before, are just a piece of the puzzle. What you need to understand is that hunger is a very complex phenomenon. It's not just hungry, eat. Hunger has two components. There is a physiological component and there's a psychological component. Think about that. When we're at a party, we feel better about eating an extra piece of pie. When we feel like we've had a bad day, we feel like we need a drink. So hunger has a distinct psychological component that is driven by our emotions. One of the great things about GLP-1 medications is that it helps to suppress the psychological component of hunger, meaning the food noise that many of you experience that leads to almost a kind of insurmountable level of willpower often magically goes away when you take the GLP-1 medications. And the reason for that is the psychological component is suppressed, and for the hunger complex, people just experience the physiological component, meaning I'm only hungry when my body is in a true state of calorie deficit and my body is asking for a caloric intake. That is the physiologic phenomenon of hunger, and GLP-1 medications do an amazing job in distinguishing between the psychological and the physiological components of the hunger. Another benefit of the GLP-1 medications that we sometimes read about, but we don't really materialize in the actual clinical practice, is the reduction of inflammation. Inflammation is just random buzzword that for many patients means a lot of nothing. If your arm hurts and it's red, oh, it's inflamed. Oh, it'll go away. But we don't really talk about the systemic effects of inflammation. And the reason why that's important for GLP-1 patients and for those who are seeking to lose weight is because stress and inflammation manifest as fat. Meaning, if you have a lot of stress or if you have a lot of inflammation, your body will start to store adipose tissue. It will store fat. So for many patients, the deposit of fat is not just a function of diet, not just a function of exercise, but a function of stress. High stress levels, and I read, particularly chronic psychological stress, can lead to physiologic changes that increase the level of cortisol. Now that's a biomarker that many of you might have heard of. cortisol. It's a stress marker. And what happens is cortisol decreases the effectiveness of GLP-1 medications. So while this is not entirely accurate, it's relatively accurate to say your stress levels affect your response levels to GLP-1 medications. So what can we do? Well, the main thing we can do is identify how to address the stress, which is behavioral tactics like yoga, meditation, breathing exercises. There's plenty of things we can do to help alleviate the stress to make you more responsive to the GLP-1 medications. How does that work? Well, let's delve a little bit into the details of it. And what I'm about to say is going to be written in the context section below in this video if you're watching it on YouTube, so you don't have to write this down. I will present all of this to you. GLP-1 medications work by enhancing insulin secretion, which is the hormone that reduces blood sugar. And by reducing blood sugar, what it does is changes the metabolism to focus on lipolysis, meaning burning of the fat for caloric take. Cortisol works the exact opposite way. It increases the blood sugar. It actually promotes the release of glucagon, which is a stored version of glucose, meaning the primary source of carbohydrate-based energy, from the liver and other organs. As a result, you develop insulin resistance as a result of stress, meaning the stress you carry leads to a general inflammatory state that increases overall blood sugar, and most relevantly to you GLP-1 patients, decreases the effectiveness of GLP-1 medications like semaglutide and tirzepatide. Now you may ask yourself, why do we even have this system in the first place? Why does stress lead to a decrease in the GLP-1 effectiveness? Well, think about this in terms of the hunter-gatherer era. When our bodies were under states of stress, it was typically because a predator was coming our way, or we're engaged in some sort of environmental stress, or there's human-to-human interaction that would promote stress. We needed a rapid energy reserve. Hence, our body acclimated to releasing all the stored sugar, all the stored energy, so that we can act on it. However, when we release the stored sugar and we don't act on it in this modern world, the stress manifests in adverse ways as inflammation. As a result, our bodies carry the fat of stress. That's a very important thing to understand when you're looking at how to optimize your weight loss. Yes, you can talk about fasting intervals. Yes, you can talk about dietary changes. But until you address the stress that you may be facing, you're not fully optimizing your body for weight loss. And here's key things that you need to focus on. And this is a very simplified way to look at this. The chronic stress creates low-grade systemic inflammation. It impairs the GLP-1 medications from being received by the body, and it increases the blood sugar itself. So it has two-tier focus in how it really hurts your weight loss goals. One, it counterproductively increases the blood sugar. And two, it makes the GLP-1 medications less sensitive, meaning there's a greater resistance in your body to the GLP-1 medications. So let's summarize a little bit about this, and then we can talk about solutions. At a hormonal level, cortisol increases glucose, decreases insulin sensitivity, meaning increases insulin resistance, and it weakens glycemic control. So you have greater sugar spikes. So many of you who are on GLP-1 medications will know that if you eat a certain sweet that you haven't in a long time, your blood sugar will spike up. As a result of that, you may be less resistant to controlling your blood sugar and less resistant to losing weight that week. We've all seen it. It's amazing how just one or two of these glycemic index spikes can really derail a week's worth of weight loss. That's just how the game goes. That's just how our bodies respond. Second thing, cortisol decreases GLP-1 receptors, meaning the GLP-1 medication, semaglutide and tirzepatide, when it goes into our body, it is received by the cells. The number of receptors that receive the GLP-1 medications can increase and decrease. Cortisol decreases the GLP-1 receptors and reduces the drug effectiveness as a result. Psychologically, cortisol overrides the sense of fullness. and it increases cravings because, as I had mentioned, when we experienced stress in the hunter-gatherer era, typically meant we needed to absorb energy and we needed to utilize that energy. So the sense of feeling full diminishes. The sense of cravings increase. And remember, when I talked earlier in this video about the effects of GLP-1 medications, I talked about the symptomatic effects. The symptomatic effects were decreasing cravings and a sense of feeling full, greater appetite suppression. Cortisol counteracts that by increasing the cravings and decreases appetite suppression. As a result, you start to have emotional eating, you start to feel less motivated about losing weight, and you start to develop these cycles of self-destructiveness where you almost feel like punishing yourself in a way. And I don't want to sound masochistic, but we've all experienced this where we've had multiple weeks of just tremendous weight loss, good diet, good exercise, and then something comes that just derails us, it stresses us out, and then we start stress eating. And we feel bad and we guilt trip ourselves into saying, why did you stress eat? And then the cycle continues. The best way to address that is by recognizing your body is responding to stress. Don't punish yourself. Instead, focus on how to reduce the stress. Some of the things you can do to reduce the stress would be to go for a walk, get some fresh air. One of the best ways to just immediately alleviate the most acute and poignant moments of stress. Another thing you can do is get in yoga, stretching, basic exercises. You don't have to do all these crazy downward dog, upward hippo, all this kind of nonsense. Just basic stretching, stretching your core muscles, your back, your torso, are very effective ways to ensure that you can help reduce stress. For me personally, the best way I control my stress is through controlled breathing. I take deep breaths in and I take deep breaths out. By actively controlling your breath, you can control your emotions. Breathing leads to emotional self-regulation. And you don't have to be some guru out in India to believe that. As a matter of fact, some of the most high-end military units in the United States focus on training active breathing techniques to help control stress levels and learn, as Jocko Willink would say, to detach from high-stress situations so you can understand how to react. Now, you can look up all sorts of breathing exercises, all sorts of breathing techniques, but the key fundamental is here. By actively taking control of your breathing, pause, you override the subconscious mind that is induced in the state of stress to lead to emotional dysregulation. By taking control of your breathing, you take control of your emotions and you enter into a state of what is called emotional self-regulation. So the next time you feel like the GLP-1 medications are not working for you, contact us at Prestige 2.0, or you can visit our website, get a hold of us, and we can work up the cortisol levels and other stress markers to see if the GLP-1 resistance is not a function of lifestyle, exercise, and diet, but really a function of lifestyle stress. And if that's something of interest to you, let us know and we'll work to find ways to make your weight loss goals a reality.